Hello, my name is David Trimberger, and this is my instructor checkoff attempt for IV Piggyback administration. Kind of like how I was explaining in my first peer-to-peer video, due to COVID and having a very busy summer, I have not been able to really be able to make it up to the lab in order to use the facilities that they have there. So I've tried to recreate and MacGyver the best of my ability things at home. So I currently have a primary line of 9% or 0.9% saline, and it's mainly just rope, a couple of spare IV catheters, as well as just a normal Ziploc bag filled with water. I also have my IV arm that I've used in previous administration videos, and that's just kind of been my whole setup for everything for right now. Carrying back on with the skill, the first thing that I'm going to do is gather up all of my materials. Making sure that I have my medication label, I have tape, an alcohol prep pad, my medication, my sharps container, as well as proper PPE, my IV solution, and my IV tubing. After I've gathered up all my materials, I will then go into my patient's room. So I will knock, introduce myself. Hi, my name is David. Would you mind telling me your name and your date of birth? I will then check with my medication label to make sure that they add up to what my patient was saying. I will then double check my medication order to make sure I'm doing my proper procedure. After I have done all of that, I will then ask my patient if they have any known allergies to medications or anything else. After I've discovered that info, I am then going to grab my medication and I am going to inspect it. I already know that this is my correct patient. I'm going to make sure that this is the right medication, I have the right dosage, I'm going to be giving this the right route, and that I'm giving this at the right time. I'm also going to be checking the clarity of the medication as well as the expiration date. After I finish that, I will go ahead and set up my syringe. I will make sure that all of the air bubbles are out of it. Reattach my needle, set that aside. I'll then grab my IV solution, making sure that this is the correct solution, that it is not expired, it is both of its tail port covers, and I'm checking the clarity of it. And then going to grab my IV tubing, going to check that it is both of its tail port covers, same as the IV, and then I'm going to check there are no kinks or twists. My flow clamp is as far up as it can be next to the fill chamber, and that it is closed off, and that this is the correct drip rating for my solution. After I've completed that, I will go ahead and put proper PPE on. I'll grab my IV solution. I will make sure that this is the correct solution. I'm then going to take an alcohol prep pad, clean my secondary injection port. I'm then going to check my medication one more time, making sure that this is the correct medication. I will combine the two. Slowly inject my medication. Then I will take this and immediately put it in the sharps container. I will gently mix together my medication, set that aside. I'm then going to grab my IV tubing, and then I'm going to, I've already said that I've inspected it. I'm at the spiking phase. I'm then going to spike my medication, turn it upside down, fill up my fill chamber to about halfway, and then to the best of my ability, I'm going to try and open up my fill chamber to not waste a lot of my medication, but enough to get all the air bubbles out. Okay. Then I'm going to take my IV Piggyback and I'm going to have it higher than my primary line. After I have all of this set up, I'm then going to grab another alcohol prep pad. I'm going to turn or close off my primary bag. I'm then going to come over to my Y port clean off my Y port. And I'm going to take my Piggyback solution and administer it to my primary line. I'm then going to tape together my two lines. I'm then going to adjust the medication, or adjust the flow rate of my secondary bag, adjust the flow rate of my primary bag. After I have finished that, I'm then going to properly label my medication. And then I will, oh, and before I would have attached this to the secondary bag, I would recheck my medication, making sure that it is the right one. And then after I've completed all of these skills, I'm then going to monitor my patient for any adverse reactions, any change in patient condition, as well as any undesired side effects. Thank you.